Hello and welcome to part 2 of my stent procedure series. I am the creator of Eastbound Tortoise, a daily vlog to practice the art of slowing down. If you have been following this series, I want to apologize that I have not gotten this video out sooner. I will explain the reason as to why that is later in this video. To those of you just tuning in, part 1, I'll go ahead and include a link in the description. It covers my venogram and my diagnosis of may-thurner syndrome. Just a really quick recap, may-thurner syndrome is when one vein is compressed by another. In my case, my left iliac vein was being compressed by my right iliac vein. It was squished to a pancake, and in my case, it was over 90% compressed. That's why my surgeon wanted me to get a stent placed in my left iliac vein to open it up so that I could have proper blood flow. So with that being said, what I want to cover in this video is going to be the surgery itself, my first 2 weeks of recovery, which are considered the most difficult, the following months of recovery, which I found to be the most difficult, and then I'll go over the pros and cons. I'll discuss what I wish I had known beforehand, and then lastly I'll finish with where I'm currently at and where I'm going to be going from here. Again, this video is just to document my experience in case it might be helpful to someone else, since this was such a unique experience for me. My hope is that someone else might find this to be helpful if they're going through a similar experience. If you do have any questions about this, definitely talk to your doctor. My cardiologist was the one who really kind of spearheaded this whole thing. She was the one who suspected that I might have may-thurner syndrome. She was the one who recommended me to my surgeon. So maybe talk to your general practitioner, get with a specialist if for any reason you think you might have may-thurner syndrome, but definitely do not take any part of this video as medical fact. It is absolutely just my personal experience. So with that being said, let's jump into the surgery. The surgery was very similar to my venogram. We went to the same hospital. This time I had to be there 2 hours early, and my mom ended up coming with us. So I had to be there 2 hours early so that they could prep me. So my prep consisted of, they give you a gown because you're not allowed to wear any of your own clothing, but they do give you a pair of socks, not the most fashionable, but hey, they were cozy. They also put in an IV, they take blood samples, they have you finish an IV bag before you go in for your procedure. I also met with not only the surgeon's team, my surgeon, which I just had to sign some paperwork and they went over what was going to happen. I also met with the anesthesiologist, and the anesthesiologist wanted to confirm that I was okay with standard anesthesia, that I wasn't allergic to anything. They also let me know that they were going to have to be inserting a breathing tube and that it might cause me to have a sore throat afterwards. So once my prep was complete, they wheeled me into the same room where I got my venogram. I was able to get onto the operating table myself. Now this time I was going to be fully out, whereas with my venogram I was partially awake for. So as soon as they had me lay down on the operating table, they gave me the anesthesia, I was out for the procedure. I think it lasted roughly about 45 minutes or so, and if I'm able to, I'm going to include a link. The brand of stent that I have, they did a video on the actual procedure of getting a stent, so hopefully that'll be a little bit more helpful. But to give you just a really quick rundown, for me, they ended up making a small incision on the inside of my left leg. They inserted a tube into my left iliac vein where they took a balloon, they blew up my vein, inserted the stent, deflated the balloon, pulled everything out. They sealed my incision with surgical glue, and that was basically it. Now I have a stent. So I woke up in the recovery room, which normally I think you're supposed to be in there for about an hour. I was in there for 2. Because when I woke up, I was feeling some pain in my back, so they gave me some pain medication. I also started shaking, which I was told was a side effect of anesthesia, so they gave me something for that. So I hung out with a very nice nurse in the recovery room for about 2 hours, and she fed me ice cubes because my throat was on fire from the breathing tube. But she was very sweet. And then they wheeled me into my room where I met with my mother and my partner so that we could talk to the surgeon. He said it was about as textbook as it could go. He was really pleased with how it went. He showed me the images, which I'll go ahead and I'll put up here, of my vein before and after, where you can see like the mesh from the stent, and then I now have proper blood flow. With all of that being said and done, he discharged me to go home. It was a bit of a painful hour-long ride home. When we arrived, I just went straight to bed. I did try and eat a little something, but because my throat was so sore, I could only handle broth. I was feeling a lot more pain at that point, so my partner went and picked up my prescriptions. So I got home from my surgery about, I don't know, an hour or so ago. I'm pretty out of it. Kevin just went to go get my pain meds as I'm starting to feel pain again. The surgery went well though. 1 stent instead of 2, so that's good. They said it went as textbook as it can get, that it went really well. So now we're just in the resting phase. My surgeon prescribed me 4 prescriptions. I can't remember all of the names, but I'll go ahead and include them here. 2 of them were pain medications that I was only supposed to be on for 2 weeks. One was a nausea medication, and the last one was my blood thinner, which I needed to be on for 3 months. That was Eliquis. I do remember that one. So yeah, I had a little bit of broth. I ended up just resting for the rest of the day. When I got home, I did try a hot water bottle for the pain, but it actually made me really inflamed. Like my fingers got really puffy. So I switched to an ice pack, and that became my new best friend for the next few months. So that takes us into my first 2 weeks of recovery. Now, I was told that this was the most excruciating part for most of my surgeon's other patients. Some of them even claimed that it was the worst pain of their entire lives. So that's what I was mentally prepared for these 2 weeks. Now, I will say, I don't know if it's because I was prepared for the worst or if it really was just manageable, but I felt like the pain was more manageable than I was expecting. If I were going, the best way that I can explain the pain level, and this may be a little TMI for any male viewers, but my female viewers might understand what I'm describing here. So during your monthly cycle, I know I feel this. I don't know if other women feel this way, but I feel like I get a lot of pain in my back, and it feels like I'm doing a back bend. And that's what this felt like. It felt a little bit worse than that. So it just felt like you're just in a constant back bend with your lower back. So that's what it felt like. Now, mind you, I was on some pretty heavy medication, so that helped a lot with managing the pain levels. But I thought it all went pretty well. With that being said, I still needed a lot of help those first 2 weeks, especially the first week. 1, I was in pain. I wasn't supposed to move around a lot. In addition to that back pain, I also had a lot of pain in my left leg where that incision was. I ended up getting a huge bruise, and I ended up limping for quite a while. So wasn't supposed to move a lot, couldn't move a lot. I was very doped up and kind of out of it. So my partner was essential for the beginning of all of this. He took care of all the household stuff. He was really wonderful during that time because I really did need a lot of help. So after that first week, my partner did have to go out of town for the second week of my recovery. So what we decided to do was have some family who very graciously offered to do this for us. But they took Dee Dee, our dog, for that week, because even though I felt okay taking care of myself at that point, there was no way I was going to be able to take care of both of us. So they were very kind in taking her for that week so I could just focus on my recovery. And although I miss them both a lot, I thought it really worked out pretty well because with my medication schedule, I had to wake up a lot in the middle of the night because I had to take those pain meds every 4 hours so they wouldn't wear off. So I was up at all weird times of the night, and I was just really glad that I wasn't going to be bothering anyone with that. In regards to the pain meds, I did start weaning myself off of them that second week. I just kind of kept track of where my pain levels were, and I felt comfortable weaning myself off a little early. So originally it was every 4 hours, and then I took them every 6 hours, and eventually I was able to get off of them. And then I had a couple left over just in case I had like a weird moment where I would be in a lot of pain, which I don't remember happening. I just had them on hand just in case. Also during that week, my mom was really helpful, and she came over and she would wash my hair for me. You're not allowed to shower or do anything more than a sponge bath for those first couple of weeks while your incision is healing. So I ended up using, they were really fantastic. They were just these cloths that were like a shower and a cloth. I don't know. I'll include a link to what I used, but they were wonderful. It took a while before I was actually able to take a shower, and my mom was really helpful being able to wash my hair because that was something that was a little beyond what I was capable of. We ended up doing this whole pillow contraption in the bathroom so I could lean back so she could wash my hair and I wouldn't be in too much pain. It was a little tricky, but we made it happen. I think that pretty much covers the first 2 weeks. I will say that I was glad for the nausea pills. What I didn't realize was that I needed to be constantly eating because if I didn't eat enough, I did get sick. The mixture of pills did end up making me sick. So I started eating just small meals every single day, and that really helped keep the nausea at bay. So that really did help. Though I will say, and I know it sounds weird to say this, but I was so tired of eating. I felt like I was constantly having to eat, and it was getting annoying. But I know one of those things, like, you feel like you just wish you had that situation where you could just eat all the time, but it got to the point where it just was painful and uncomfortable, and I didn't like it. So that leads us into the following months of recovery and why it has taken me so long to get this video out. So I don't want to sound overly dramatic about this, but this probably was one of the worst experiences of my life. The surgery itself was fine. The first 2 weeks of recovery were fine, but the following months after were a nightmare. And I attribute a lot of that to the blood thinner Eliquis. Now, I can't say a lot of this for sure, but while I was on it, I found that I became very paranoid. My anxiety went through the roof. I was having very strange side effects. I can't remember what they all were right now, but I felt like a crazy person. I really wanted to get a video out after those first couple weeks for you guys, but I had no idea what was going on with my body. It was all over the place. So I made an appointment with my general practitioner, and I did my general practitioner, not my surgeon, because some of what I was feeling I didn't think was related to my surgery. And so she and I discussed a few of those things, and she sent me to a specialist for that. But while I was there, I did mention to her that my left leg had been very tingly. Like, I'd been having some issues with it. It felt weak, it felt tingly. My left leg felt so weird, and that was the leg where the incision was. So she called a friend of hers who I think does the same thing that my surgeon does, but anyway, they felt that I needed to go to the ER to get this checked out because it sounded too close to a blood clot, and they just wanted to make sure that I was okay. So they sent me to the ER. I had an ultrasound where they confirmed I did not have a blood clot. They thought perhaps it was the fact that I did have a hematoma that they could tell because they could see it was still healing, but there was still a bruise there. And they thought it was probably just from my not using that leg, and that's why it felt weak and sore, and they said, give it some time, it'll probably go away. Which it did. for a little while. It ended up coming back a few months later, but I'll get into that in a bit. So after that ER visit, I did work on walking some more, and it did begin to feel better. Now, it is standard procedure that I needed to have follow-ups with my cardiologist, where they would do their own ultrasound, and they made sure the stent was where it was supposed to be, that everything was flowing where the stent was, that all looked fine. And I did discuss with them the issues that I was having with my blood thinner Eliquis. And they had upped one of my other prescriptions to try and counteract the issues with the Eliquis, but that medication made me feel like I was being electrocuted. So it was an absolute nightmare. Like, they tried me on I had some doctors try me on some other medications, and whatever side effects those medications had listed, I ended up getting. I became so sensitive, and it got really scary. There were days where my blood pressure just dropped. There was another time when we changed my medication, and my heart was beating so fast. I mean, I had to call my mom over a couple times when I was alone just to watch me in case we needed to go to the ER. It was really scary. My body was doing things that were so unfamiliar, and it was terrifying. It was absolutely terrifying. I would wake up in the middle of the night, never having felt that afraid in my life. So the next time I went to see my cardiologist, I mentioned again the issues I was having with the Eliquis, and could we put me on something else? And she decided that she felt I was okay enough just to come off of the Eliquis entirely. And she thought that I really didn't need to be on it, but that it was just kind of a precaution on my surgeon's part. So instead she ended up putting me on a baby aspirin, which I'm still currently on. I'm hoping that she'll take me off of it soon-ish. She said I needed to be on it for at least a few months, at most a year or so. We'll kind of see where that goes. So once I got off of the Eliquis, it took a long time for the effects to subside, and that was another reason why I hadn't put out a video yet, because I was still having pain, and I was still having some side effects, and I didn't know what was what. What was from the surgery, what was from my long COVID symptoms, what was side effects from the medications, was the pain something else? I didn't know where to go with all of it. So I had to wait until things settled down so I could kind of figure out what was going on. And it really wasn't until recently that I kind of felt like I had an idea of what was what. So with that being said, in those months that I was kind of coming off of the side effects from all the medications, I was walking a lot more, I was doing a lot better, and I don't know what happened. I was on a walk with my dog, and I don't know if I tweaked it while we were on our walk, but when I got home, I was in excruciating pain. My back was in a lot of pain, and that kind of tingly, weak feeling in my left leg came back. So I reached out to my cardiologist. She immediately had me come back in for another ultrasound. She said that looked fine. So we reached out to my surgeon, and he put me on a medication, but that didn't help. And so he said I had to come back in for another venogram. So I went in for the venogram not too long ago. I want to say it was about a month from when I'm making this video. He said everything looked fine, and he really doesn't know why I was suddenly in a lot of pain and why my leg has been so funky. But they gave me some pain medication to get me through that excruciating pain with my back, and it did eventually subside. And we're looking into possibly my going into physical therapy to help with the leg. So that's kind of up in the air. So that's just there was a lot more within all of that, but that kind of sums up the main reasons why I still haven't, or the main reasons why I haven't gotten a video out until now. So let me go over the pros and cons of this surgery. The biggest pro is that I have some more energy than what I had before. It's not a ton, but it is enough where I've been able to walk again. Not great distances, but I went from barely being able to walk to my mailbox and back to now I'm walking around the neighborhood twice a day. So that's been really wonderful to have that back again. I'll also say that my crashes went away. I don't know if anyone knows about fatigue crashes or long COVID crashes, but when I would overexert myself, I would get to the point where my body would completely shut down. I couldn't move, I couldn't speak. I've gotten to the point where I have been exhausted. Like, I've gotten to the point where I'm extremely fatigued, where I have to rest, and it takes me a while to come back. But I haven't had that catatonic state since getting this surgery, so that's been amazing. I'm a little bit more clear. My family has told me that they have seen a big difference. So that's probably been the biggest pro of getting the surgery, and that is really big. Some of the cons. The issue with my leg is driving me insane. The inside of my leg is still tingly. It's just, I am doing some at-home physical therapy, and I'm still walking, and it is helping a little bit, but it's maddening because my leg was perfectly fine before this surgery. The fact that all of my doctors have no idea what's going on, they don't know what to do with it. But I guess since internally they're saying everything is fine, maybe eventually over time it will go away. So that's a con. Another one is I can feel the stent. Not all the time, but it does still hurt. My surgeon mentioned specifically, he said it may just be that I need to build a callus, like it just needs to build a callus around it, and then maybe over time that pain in my back will go away. But that has also been really frustrating, that I have this pain in my back, I have this pain in my leg, and it's really obnoxious. So, and I think I just kind of have to be patient and let my body heal. From my understanding, I should have been fully healed by now, and everybody heals at their own time, at their own pace. Some people it takes longer than others. I really thought I would have healed faster than this, and that's just been frustrating to me. But I'm a little bit more accepting of it now that I know that everything is kind of okay, that maybe I'm not in those scary stages anymore where I thought something internally was really wrong. I feel like I can relax a little bit more and just kind of let time do its healing. So I think those are probably the biggest cons. And there's more to it than that. The way I've explained it to my family is the benefits from this are wonderful, but the cons, I don't want to say outweigh the positives, the pros. I'm not to the point where I'm grateful for this surgery yet. Like I mentioned before, this has been really traumatizing, this recovery. And I don't know that I've properly expressed why it's so traumatizing, but I'll just put it, it's really complicated to try and explain. So I'm just gonna say it was a traumatizing recovery, and I'm just not at the point where I'm fully grateful for this surgery yet. But I am hopeful that one day, if this pain in my leg goes away, if the pain in my back goes away, then I will be so grateful that I got this surgery, because as I mentioned, I have some energy again. I have a little bit of clarity again. I am in no way past my long COVID symptoms. I am still unable to do so much, but I have been given a little step up. It's maybe just 1 or 2 steps, but it's been enough to give me hope that maybe I can build on this. Even if it takes a long time, perhaps this is something I can build on. So we'll see where it goes from there. A few things that I wish I had known before going into this. Some of the little things, we have a very tall bed, so I didn't realize it was going to be really difficult for me to get into it. So fortunately we had what's called an apple box. So it's just a little, it's just a box that I was able to step on to get into the bed. That was really helpful. I wish I had known that I could be so nauseous. So I wish I had known that I needed to really eat all the time with these medications so that I wouldn't get sick. I really wish I had known how awful blood thinners are. I know it sounds like I'm being overly dramatic, but it was awful. So I would say, I wish I had known that I could switch up my blood thinner earlier, because I got to the point where I just justified it as, well, I only have to be on this for 3 months. Well, let me tell you, it is that agonizing, every day feels like a week. Every week feels like a month. So 3 months felt excruciatingly long. I was so grateful when my cardiologist told me I could come off that blood thinner. So I would say, I wish I had known that if I was having issues with the blood thinner, that all I needed to do was reach out to my doctor and they would have switched me to something else. So that's definitely something I wish I had known. Other than that, was there really anything else? I can't think of anything else right now. As I said, it's been a long time since my surgery. I really wanted to do a video while it was all still clear in my head, but this amount of time has just been so fuzzy, it's been so confusing that even though I wanted to try and tell you guys as much as I could, a lot of it just got lost. So hopefully some of this will be helpful. If I think of anything else that maybe I missed in the video, I'll put it down in the description. So that just ends us with where I'm at and where I'm going from here. As I mentioned, I'm looking into physical therapy for my leg. I just have to be patient with my back. I do end up using, I've got like this Advil roll-on thing that I can use on my back because Advil does not mix with aspirin, so I can't take Advil. So occasionally if I'm in too much pain, I'll take Tylenol. Otherwise I use this little Advil roll-on thing, and that's really helpful. So yeah, I just kind of have to be patient, I think. I do have some other health issues that I'm dealing with that now I know, now that I've come down off of all the chaos from the surgery, I know that these things that I'm dealing with are not related to it. I'm having to go to separate specialists for that, but that's kind of normal for me, or at least it has been for the past 4 years. Hopefully I can meet with the right doctors and I won't be in so much pain, because lately I've just been a ball of pain. So I'm hoping I can get some answers to some of these other things and maybe that will help. So I don't know if I'll ever make a video to go into any of that. We still don't know what some of it is. So it's a journey. It's a journey I didn't want to take, but here we are. So with that said, that was my experience of getting a stent. Again, I mentioned this in my first video. My stent was due to my long COVID symptoms. I didn't have a blood clot, which is how most people find out that they have may-thurner syndrome. My cardiologist, who I've been working with for a long time now, for my long COVID symptoms, she was the one who really spearheaded this. And I really am so appreciative of her for everything that she's done. She has been so creative throughout this whole process, and she's really pushed to make sure that I have the best care from her. So I think that's it. If you have any questions, feel free to let me know. I know I said that this might be a 3-part series. I don't know that I'm gonna do another video after this unless something big happens, and I'll update you guys on that. But I think this kind of concludes it. So if you do have any questions, please feel free to ask me in the comments. As I said, I tried to be as detailed and as concise as I could. It's just, surgery is not always easy. This was my first time. It went well and it also went horribly. So, as always, thank you so much for spending this time with me. If you need a moment to slow down, please feel free to look at my vlogs, and I wish you all the very best.